Hey, everyone. It's Dr. Tamara Beckford with Your Caring Docs, where we are bringing you all the health and wellness info so that you can be empowered and make some great decisions, right? But we have beautiful and awesome section called our Your Caring Docs, Docs Who Care, where we bring doctors from all over the world and they drop their gems on all the health and wellness info that's out there. The best thing is that you will know where to find them, and you'll be able to find them on our Your Caring Docs page, right? Today, we have a special guest. So today we have Dr. Diana Londoño. So Dr. Londoño went to medical school at David Geffen School of Medicine at UCLA. Then she did her residency in urology at Kaiser Permanente in LA. She's currently a practicing urologist in the LA area. Now, let me tell you why this is so awesome and why I'm so excited to have her on. So Dr. Londoño is one of 10% of women who are urologists. And out of that, maybe 0.5% of them are Latinas. Now, we have approximately 13,000 plus urologists in the US, and 0.5% of them are Latinx, right? So Dr. Londoño, we're gonna be getting all up in the business of what a urologist is. She's gonna go over a little bit of stuff about the male and the female. So I know you males listening, yeah, you're gonna wanna know how we can lift that front end up and keep it up. Boom. And we're going to talk about as much as we can about some risk factors and also some of the ways that she plans on helping all our other Latinas or Latinos who wants to increase the diversity in urology, right? So before we get further, let's bring in Dr. Londoño. Yes, welcome. How are you?
Thank you, Dr. Bradford. That's a beautiful introduction. So thank you so much. I really appreciate it. That's very kind.
Hey, all the best for the best, you know? So first of all, I use this big term, oh, she is a urologist. And I know a lot of people are like, okay, what, she takes care of the brain, a neurologist? And I'm like, no, not a neurologist. She is a urologist. So let's explain to all of our audience what a urologist is.
Yeah, that's a great question. I mean, most people, don't even know where their kidneys are when you ask them on the street, where are your kidneys? And they show you like your lower back, and they're actually up high by your ribs, up here. So even that, knowing where your anatomy is very hard for a lot of people. We just are not really taught that. But yeah, a urologist is a surgeon that, not only does surgery, but also treats you in a lot of conditions with medications or different treatments anywhere where really the urine passes. And so if you start at the kidney where the urine is made, it goes down these little tubes called the ureters, like a really hard word to say, especially if you have an accent. And it goes to your bladder. The bladder is where you store your pee, and then it comes out. So anywhere where the urine passes through, or it goes through the bladder, your prostate, which we'll talk about, penis, testicles, all the genitals for both men and women, we take care of that. There is a little overlap, obviously, with that gynecologist, and with other specialties in some ways, and with a nephrologist. Nephrologist is a doctor of the kidneys, but they deal with more medical reasons and dialysis and other things that we don't deal with, but we're complementary. So we're a little bit of like the plumber. Some people describe us as that. We help with something is blocked in the tubing, in the piping, either something in the, in the tubing is not working right, it's clogged, right? So maybe a keystone is blocking. We take care of unblocking it. We also, like if it's overflowing the toilet, like now you have incontinence, or you just have too much urine in there, too much water in the toilet, we've helped fix that. So, some people find it easier to think it's plumbing. Yeah, we're that, but we actually do a lot of stuff, a lot of preventative things, which we'll talk about later: prostate cancer prevention, urinary tract infection prevention. So a lot of things that we prevent as well as treat, both medically and surgically, just like kidney stones. We can treat with surgery, but we can prevent it and maintain that you don't get them with a lot of different things. So it's really fun. And I also want to not forget something called the adrenals. They're little glands on top of the kidney. We also treat those. I mean, there's no urine made there, but they're right on top of the kidneys. We also take care of that. But really all the stuff.
All the stuff with the plumbing.
All the plumbing and all the fun organs, like all the genitals people get excited about. So we do that.
Absolutely. So now we're going to just kind of jump in. Now that you talked about the plumbing and we're talking about the overflow, we're going to just talk about, because of the fact that Dr. Londoño's specialty, it helps to treat surgically male and female. We're going to try to touch a little bit on the male and the female so that you can all feel empowered, right? You understand if you're on this section of the sexes, or if you're on the other side, then you'll understand. So we're going to first start a little bit on the female, right? So we're talking about the overflowing plumbing, which we're going to call urinary incontinence. It's like this little nasty secret that happened with women, where you're laughing and there's a little bit of squirt. That's what we're calling about the overflow plumbing, right? You're coughing and there's a little squirt. So it happens there. So let's try to find ways. How is it that we can normalize that in women? Let them know like what's happening and how it can be corrected.
Yeah, it's so interesting how you present that, because that's absolutely true. There's a lot of stigma to that. And actually it's really, really common. So women 18, which to me seems like mind blowing, 18 years old to 65, 25% of women are going to have some type of leakage. And it takes on average about 7 years for a woman to come to a doctor to tell them about the problem from the time that this starts. And 50 to 70% of women don't even go to the doctor to get any discussion about it or any treatment, because there's a social stigma about it, or there's a stigma like, well, that's just how life is and I just deal with it and I just wear, like either a diaper or pads or whatever, and that's just what it is. And so there's a lot of stigma to it. And obviously it's quality of life versus, cancer or something like that, but it's just as important, because if you can't leave your house and go on vacation or do stuff because you're leaking or you're worried about the smell or something, it affects you and your mental health, which is so important. So absolutely, there's no reason to discredit just because it's not cancer, because it's just as important. So, it's just really hard to even know how prevalent it is, because people underreport it or we underdiagnose it because we don't even ask about it. What I think is important to know is just the definition. Well, what is incontinence? Incontinence means you're leaking. And there's really two types of leakage, which makes a difference because they're treated very differently. So you can have something called stress incontinence. That means you're coughing, sneezing, lifting, and you leak. And you can have something called urge incontinence. That means that you're sitting down and then you get the urge to go, and as you start to go, you can't hold and it comes out. And again, they're treated very differently. The cause of them is differently. The cause of it is different. And so it's important to know which one you have. And many times you have both. But many times it's important to know which one bothers you more. Like if you're really active and you go to the gym, well, obviously maybe that's more important in that case, because you don't want to leak at the gym. And the other one's okay because you can just go frequently to the bathroom. So it just depends which one is more bothersome. Do you want any treatment? And you don't need to have any treatment if you're not bothered by it.
Right, absolutely.
That's okay too, but just some people, just want to make sure, is it normal? Should I do something about it? And for some people we don't have to do anything. But if it's bothersome to you, then it is bothersome to me because I want to help you.
Absolutely. And that's such a startling statistic. Between the ages of 18 to 60, 25, so a quarter of us are experiencing it. And it's probably more, as we mentioned, because we've had that just happens, if you've had kids, just expect it. It's a part of life. And it's this little secret that no one talks about because there's an embarrassment aspect to it. So we're letting you know that if this is happening to you and it's affecting your quality of life, it does not have to. Talk to a urologist and they can help you, or a gyno-urologist, and they can help you with that. Now, that was our little tidbit for our females. We're moving over to the males, because I know a lot of you males who are probably listening, or our females who are helping, our significant others or brothers, cousins, uncles, grandpa. Let's let them know what's going on, right? So we're going to talk about prostate cancer. This is something that happens within a couple of the different communities, some higher than others. So Dr. Londoño, tell us all about what we can, put in the small visit about prostate cancer.
Yeah, well, prostate cancer is really interesting because it's actually very common. It's the second most common cancer that men can have, and the second cause of cancer death actually. So it's really common. 1 in 8 men will have prostate cancer. What's really interesting about it that people have a hard time wrapping their mind about it is they tell me all the time, well, I feel fine. I have no symptoms. I don't pee at night. There's no blood coming out of anywhere. So if there's no blood, people don't worry. But when there's blood, people worry. But
absolutely,
that could be a symptom of, yes, of course, prostate cancer, but a million other reasons. But the key is it's asymptomatic. You have no symptoms in most of them because more than like 90% are just local in the prostate. They don't get diagnosed when they're outside the prostate. So they really will have no symptoms as we think about it, like how, it'd be another cancer where you may have a stomach pain or you're coughing blood or, something is obviously different or there's a growth. You're not gonna know that. And your prostate is inside of you. So you can't.
And it's deep.
And you can't yourself as a person touch it or feel it or know where it really truly is. So, you don't know where it is. And it really is deep inside. It's right below your bladder. And I kind of think of it like as a, like a caramel apple with a stick, those little sticks. So your caramel apple is your prostate and the stick is the tube where you pee out of your urethra. So you kind of think of it like that, and it's just deep inside your pelvis. That's where it is. You're kind of really sitting on it when you ride a bike. It's right where, the skin is on you sit there right deep to that. So you're not going to find it. Really, the doctor needs to kind of find and feel for it. And that's kind of important about like screening because you're not going to feel anything. You don't know something is wrong. And you can certainly have prostate cancer. Yeah.
So when should the male consider to start getting screened for prostate cancer?
Yeah, this is really important. The main thing is, well, what's the risk factor? And so the main risk of you getting prostate cancer is one, age. The older you are, the higher the risk. And most people are diagnosed around 65. So the higher there. So I'll talk about when we start, but also family history. And it's not like your uncle, Bob, 3 generations down. It really is your father or any brothers. If they were diagnosed with prostate cancer, say at like 74, then that's a little bit higher risk. If they're diagnosed at 95, it's not as high of a risk, but really the younger, because again, the older you are, the higher chance that you're going to have prostate cancer, and you may die with it, not of it, but we'll talk about that. So age, family history, and also race. So African Americans have a higher risk. So if I have a patient that's African American, you really are, leaving your antennas a little higher on, worrying about when to start. So most people, if they don't have those risk factors, the recommendations from our guidelines nationally is 55. We definitely recommend against it below 40, but at 55 you're going to start, and usually you stop around 70 unless you have life expectancy more than 10-15 years. So that's kind of when you start, when you stop. And how do you do it? Most people are like, oh my God, I don't want to go, what's going to happen?
Yes, that's usually the what do you mean? What are you trying to do to me?
So the good news is it's a blood test. You don't even have to fast. You just go to the lab and get a blood test. That's called a PSA, prostate specific antigen. It's just PSA. And what it is what it means. It's specific to the prostate. And sometimes if you have a bigger prostate, it can make more. But all I really truly care about this PSA, is it going to show me if there's a risk for cancer? The rest of the stuff we can deal with. But it's just the best screening tool we have. And like an exam. And how's the exam? Well, yeah. The doctor has to put their little finger, and the good news is women have small fingers. So that's a great news. Okay. So don't find those women urologists with small fingers, but really we just have to put our finger and feel it. Just like if we would feel if there was something on your shoulder, like, do we feel something hard? Because if you feel something hard, and your PSA blood test is high, the higher it is, and the chance that you feel something, those two put you at a high risk that you're going to find prostate cancer. So it's not just one or the other, because it could truly miss it. And if you have a blood test and no exam, when you're going to then try to diagnose it, which is done with a biopsy, you want to know where to target the biopsy by knowing where you felt it. It's not, if not, it's kind of like flying blind. You want to know where you felt it, because I'm going to focus in that area and in the other areas where you normally find it. So it's really important. And I want to know, how big is your prostate, just as a baseline, because it can help me with maybe symptoms you're having from just the enlarged prostate. So yeah, it gives you a lot of information. If we didn't have to do it, believe me, I wouldn't want to do it either. Like, it's not fun for me, but it's really important.
It lasts approximately how many seconds?
Yeah, it's like about 2 seconds. I mean, it's like 3 seconds, really just get an idea of like, what's the size, what's going on, and be done with it. And we get out and we just move on, because it's really important. And yeah, like, again, go find a woman that has smaller fingers. I mean, I'm kind of joking about it, but you know, nobody wants it, but we got to do it. Just like a woman doesn't want the internal exam or PAP, it's uncomfortable, but we do it because it saves lives and it matters. And especially like Latino communities, African communities, they're just a higher risk. That's just what it is. And so just kind of getting over it. Like, you just got to get down, or you got to go to the dentist. Nobody likes it. You know, I don't like it, but I got to do it.
Right.
So just doing it, get it over with. It'll take 2 seconds. We'll be done.
And it saves lives. It saves lives. Can we reiterate it for those in the back? It saves lives.
I mean, if there was another way, like, I'll do it. I'll be the first one to say, let's do the other way, but there isn't right now. So once we have a better testing tool, let's do that one all day, every day. But other than that, like, there's no shame. It's just your like prostate, you know, it's not a big deal. We just got to get it done, you know? So it's important, because most of these are found locally, because we didn't have symptoms. So there was nothing to feel for or know about. And the good news is prostate cancer, you know, it has actually the highest survival rate of all cancers, right? That's the best news. So let's find it early. Let's find it when we can treat it. It's not outside the body. And many of these can be something you're going to die with and not die of. And that's the good news, but we got to know about that it's there. And then we make those decisions like, well, is this, you know, the more aggressive prostate cancer, or this is more of something less aggressive that we still have to know about, but we may not need to treat it right away at all, you know? So it's just really pretty important. Yeah.
Wonderful. And that's important to state too, that, you know, it's one of those cancers that if it can be found, they can determine, is this an aggressive one, or is this one a less aggressive? And the survival rate of the prostate cancer is the highest of all the cancers. So this is why Dr. Londoño is saying that let's just get it over with. 2 seconds. Let's figure it out and see what's going on before we're finding it when it has moved outside. Because while it's in the prostate, they're less likely that you're going to have any symptoms. Think of the candy apple with the stick going through it. Nobody's sitting there worrying about it, right? So you get tested, you get screened, you find out the risk factors, you find out what type, and, you know, we try to make sure that you are your healthiest for the longest, right? So that's how we do it. Now, we know that screening for prostate cancer, we said that with age, you know, the risk factors, if you are not within the high risk category, that with age, you more likely will end up with prostate cancer the older you are as a male. Now, another thing that males are really worried about is erectile dysfunction. Woo, man, I wonder why. So let's talk about what are some of the most common causes that you as a urologist see for erectile dysfunction, and what are the most common preventable causes of erectile dysfunction?
Yeah, these are great questions, because it sort of follows kind of like prostate cancer. Age is the biggest risk factor. The older you get, the higher risk of, you know, having problems with an erection. And problems with erection means that you cannot, you know, maintain or sustain as desired by you. And so you may not be able to maintain it or penetrate, you know, with the erection. But age is the #1 risk. That's just what it is. And the other ones are really like medical problems. So the medical problems like diabetes or high cholesterol, high blood pressure, those affect the erections. And why this is really important. It's really interesting because the nerves and the arteries that go to the penis are one of the smallest ones in the body. And actually they're smaller than in the heart. And even erectile dysfunction is actually a symptom of like heart disease for the future. Because if it's going to plug up the arteries going to your penis, and then you don't get blood flow to the penis for an erection, it's going to do that in the next like smallest arteries, which is in the heart, and then you're going to have a heart attack. So erectile dysfunction is kind of like, hey, hello, like something's not going right. And
a little signal, right?
It's a symptom, is a signal like hello. And usually erections are really important. So people pay attention like, whoa, something's going on. But people don't worry about their heart attack until it happens. But when it's the erection, it's really like, well, I need to do something about it. Right. And how it works is, again, it's kind of plumbing again. If your cholesterol is high, then the cholesterol deposits in the arteries and it plugs the arteries like the tunnels. So if there's nothing going in the tunnel, or blood going through these arteries, you're not going to get an erection, because an erection is blood fills the penis. You have your erection, you have sex, what are you going to do? And then when you have your climax, then it goes down and the blood gets out of the penis. So if you're not getting the blood in, you're not going to have an erection. And that's because now it's plugged up with cholesterol. So that's really important to prevent it. Now, sugars. Well, why do sugars matter? Well, we always hear about like check your feet, check your eyes, because it affects those organs, but it affects your penis. How? Well, the nerves that control erections, if they're damaged, just like your feet are damaged, they're not going to work. The signal's going to get plugged up. It's sort of like those rock candies, you know, like it gets all full of like speckled candy, right? Or sugar. Instead of like the signal going easily through, you know, because it's smooth, now it's all plugged up with sugar. And so like, oh, it can't go through. Yeah. So it's the sugar being high, it's going to affect your penis. So, you know, if you care about your penis, you know, you got to care about the sugar. Even people are like, oh, whatever, I don't care about sugar. It's actually really important. If you care about your erection, if you don't care about your erections, you know, eat away, like don't worry about the sugar. It doesn't matter. But if you care about it, or you're going to care about when you're 45 and then your penis is not really working that well, probably today is the day to start thinking like, what am I going to do about it? So preventable, really important, because it also, again, it's a symptom of future heart disease. That matters because you're going to have a heart attack and stroke, and with that you can't even have sex if you're like in the wheelchair usually. So you got to think about, why is that important? Yeah, so super important. And again, the good news is you have the power to make those changes. Like, now, of course we can give you medications and this, but if you have the mental awareness, well, maybe I should not eat all those foods that are not good for my sugar levels. Maybe I'm going to go for a walk and make those changes today. Then you're eventually going to get off the medications. You're going to have a better health. You're going to feel better. And if you feel better, your mind is better. It's all together. We can't separate the mind from the body. Absolutely. Wow. See, look at that. Just that small issue. Well, I guess I won't call it a small issue because it's for the male. It's a big issue if you're unable to have the erection, but it's a signal for future medical issues, which is so important. So, you know, if you're unable to have that erection and you are having, like, say, you know that you're diabetic or you have high blood pressure or you're having cholesterol and you're unable to have that erection, that's a signal of future other more complicated things that can happen, such as in the heart. So if you're at the point, if you're 25, you're 30, you've been diagnosed with diabetes, it's not as simple as, I don't really care if my sugars are high. No, in keeping that in mind, once you damage those nerves. Yeah, they're reversible. I mean, some of these are irreversible. Some of it you can like definitely help it and fix it for sure. But some of it, once you damage it, like you can't bring it back. And then we're going to talk about treatments, which of course, that's what we do as urologists. Of course, I'm going to give you all the treatments and all of them. There's a lot of them. But if we can prevent, I mean, I'd much rather prevent for a patient any day, whether again it's problems with erections or kidney stones or infections or whatever it is. I'd rather prevent than treat it. As much as I get joy treating it, I mean, prevention is huge. And yeah, I can just give you that, but I don't have to talk to you about the causes or why it matters. Of course, I can just give you the pill or the surgery, but if I really, I think, care of like what your long-term health is, I'm going to make that little conversation of why it matters. And I do, because I think it's so important. And sometimes you just don't know. Nobody tells you. So if you don't have awareness, it's not your fault. Like, people never explained it to you. So it's not blaming like, well, yeah, you didn't do it. No, nobody told you. Nobody explained it. So we've got to educate. We got to tell people why it matters. And then they can choose to take control of their like daily activities, life, or not. And that's your choice. But
you understand why you should do.
Yeah, why it matters. If it matters to you. Again, if it doesn't matter that you don't have erections, no big deal. Like, keep on that sugar level 400 every day. Fantastic. But truly, if you care about it, this is why, and not just because of the sugar and the damage of other organs, but you're just going to feel better if you're not like walking around a sugar 400 every day. You'll feel better. You're just going to feel better every day,
Absolutely. Absolutely. Wow. And it's so important, as you mentioned, about educating and informing and letting our patients know what is possible. Number one, if you do not adhere to a treatment plan, or what is possible if you do not understand what's going on within your body. Now, we've talked also about in the minority community, there are some higher incidences of some of the diseases that we've mentioned, such as the prostate cancer, and also with diabetes, hypertension, it's also very, very high in the minority community. Right. What's also important is that I know that there are a lot of people who are in minority communities who want to see doctors who look like them.
Yeah.
And I know that this is also an aspect that's very important to you. So out there, we've talked about it. I mean, you're a urologist, 0.5%. That is like mind-boggling. Right. And I know that you're out there really trying to do your part in helping to increase, especially within the Latin community, to increase the amount of Latin urologists that's out there. So let us know, what are some of the things that you have done so far? And I know you're doing some mentoring, so let us know some of the success stories that you've had being a mentor and helping some of our Latin urologists, or even if it's females or male, come into the field.
Yeah, I mean, I think it's like multifactorial. I mean, I think for me, it's always been, of course, mentoring is really important, whether people reach out to you and you never think you'll be a mentor, or you reach out to others to see if they would be interested in any help and help them through their journey, or even getting them into the programs. But I also think it's like community is really important for, like, again, kind of going back to education. Like, when I was a resident at Kaiser in Los Angeles, I mean, I used to do a lot of educational, talks, on the Telemundo, Univision, all these local channels to really explain really what we're doing today on the TV stations, because it's really important that we understand the problems of community. And yes, of course, sometimes if there's a language barrier, well, it's going to be hard to, in 15 minutes, 20 minutes, whatever your appointment is, figure out what the problem is and then do all the education, all that. With a language barrier, of course, that's hard. But regardless, we got to teach our communities of what's going on, why it matters, educate about diet, educate about why exercise matters, educate about the consequences of all these problems. Because even going back to incontinence, age, but weight is so important. And the heavier you are, the higher risk of incontinence. So it all relates, like with weight and with diet. I mean, it's all coming from the same thing. So, a lot of the health or illness is due to like really what we do as what we're putting in our mouth, or what we're doing with activity, leading to like a whole lot of diseases. And if you change how you're thinking about it, then you will change like the outcome and your results down the road, right? So it's really important. So I think education is key. We really have to do that. I think, mentoring other, physicians, whether they're already urologists or even before they get to decide, I think is really important. And those things are key, just about equity and, because there is, in a lot of our communities, not, equity, equality, and so, how are they going to find you if you're one of, you're 65, one of 65 of the whole country that are Latina, And a woman is, you're not going to find that maybe once in your life, of course. So, but that's okay. And even if you're not the Latino or African-American, urologist or doctor, it's okay. But then you also have to ask, and I know our communities are hesitant to ask the doctor, to like question the doctor, but we gotta ask. If your doctor is not informing you, you gotta ask, because you gotta be an advocate for your own well-being, your health. If you don't understand, then you gotta ask, because it's really, really important. And obviously doctors have different styles. Some are more educators than others. Some are more prescribers. Some are more, surgical technicians, whatever. But we gotta start empowering our communities to ask, because there's nothing worse to get a pill that you don't know why you're taking it. Why are you taking this medication? Like, you don't know. So if you don't know, you're not going to take it.
Not going to take it. Absolutely. And I see that very often.
Yeah, it's like, well, I have 35 pills. Well, like, I don't know what they're for. No, you got to know. Otherwise, we're not taking the pill, because.
Or half bottles of antibiotics from 2 years ago that they pop because they're not really sure why.
Why do we have it? And we take 2 antibiotics at the same time. We don't even know why, because we got confused. No, we can no longer be confused. We can no longer not know why we're doing stuff. It's not a doctor's job to just tell you. It's your job to know why too. And I'm not saying you have to be like educated to know all the stuff in medicine, but all you have to say is like, why are we doing this? What is this for? What do you think? What's happening? Just why? I mean, why is like such a powerful question that, like, toddlers do all day. And like, we lose that as we get into adulthood. We stop questioning why are we doing this? Why is this happening? But just ask, what is this for? Like, why do I have to take this? And maybe it's because of this, because if you take this, you'll be able to pee better. Or if you take this, it's gonna decrease your frequency. And then when you understand as a patient, you're like, oh, okay, that makes sense. I definitely want to do that, or I do not want to do that. But we gotta know why, right? Why are we recommending to you to do things so you can be empowered with knowledge and be like, absolutely, I'm on board, or like, oh no, I'm not doing that. Or like, what are the side effects? I mean, I just want to know before I start something, because then you're come back constipated and with dry mouth, you don't know why. Well, because that medication can cause that. So you gotta know. Hopefully we're telling you, right, that we're doing our part. But you also as a patient, we gotta be a little bit more empowered that it's okay to ask.
And one of the techniques too that I've also, I think I even made a little PDF for patients to really just have a list of what medications you're on, and a list at the bottom for notes. So, at the end of your visit, what are some of the notes that what did you start? This is what the doctor is going to prescribe, a medication to help with blank. And then also so that you can have those notes for when you go back. Hey, we started a medication for A. However, I'm still having A, or these are what I'm noticing. Constipation in my mouth is dry. Is this a side effect of this medication? Or because this will all help you with the quality of life, right? If you understand, then you can incorporate this. Is this something that you can tolerate with your quality of life? And one of the things that we also, as doctors, also want to let patients know is that there's usually more than one tablet for this particular issue. So if you're having the quality of life is not helping with one, just let us know.
Yeah, like things are not set in stone once you do so. I mean, for urologists, it's a little bit easier because a lot of things are like, well, it's going to help you pee better or have a better flow. So we can try it. But if you're doing fine and I don't see anything worrisome, well, we actually don't have to start anything ever. But if you tell me, you know what, I really want my flow to be better because it takes me a long time to pee, then I'm like, well, this is what I have. This is how it works. And these are the side effects. And let's try it. And, we can try it for like 2 weeks. And like, if it's awesome, you come back like, whoa, I feel so much better. Fantastic. Let's keep it. But you say like, you know what? I didn't do anything. Let's stop it. Like, why are we taking medications that you don't need? I'm a big believer of like less is best and like just, but if you need it, we got to do it. But if you don't need it and you're happy without it, like, let's not give you 1,000 medications. Like, we just get confused. We like too many. It's like costly. I mean, why? Yeah. So I'm not like going to prescribe stuff that you don't want or need. But if you need it, we definitely have to talk about you need it. And obviously you can choose not to, but I'm going to strongly recommend, this is why I want you to do it, not because I get pleasure from prescribing stuff. It's just because you're going to like have bad outcomes if you don't do that. And again, you can still choose, it's your choices, but I just want to educate you. I want to make sure you understand why, and then you make it's like free will, you make your choice, but just like an informed choice, right?
Absolutely. And that's one thing I love about you. So you're such a patient advocate champion. I mean, she is all about, of course, ensuring that the patient is informed, they're empowered, and that you make that decision from a point of understanding, right? It's not a just here, take this and go sit somewhere. No, understand why you're doing it, why you're taking this medication. If you want to, go ahead, based on our treatment plan. If you can tolerate not having it, like we said, less is best, so Dr. Londoño is not going to just add medications just to do so. So now that we have like gone all into the male and the female, so now let's get all and find out, what does Dr. Londoño do for fun? What do you do for fun?
Well, I have 2 kids, so I have a 5 and a 3-year-old, so they can be busy, but I have an amazing husband that, stays home and definitely does a huge part of, helping and being the best dad and do that. But definitely for fun, we do stuff with my kids. They both know how to ride their bikes, so we go bike riding. We'll go like on hikes with my kids. We'll go to the pool. We will go to the beach. They love the beach, so we'll do that. I like to run because it helps me clear my mind. Helps me sort of meditate, and I listen to incredible podcasts during that time, and it's my alone time. So for me, I do that. I recently started writing, so I write a lot of articles of things I feel passionate about. And they've been published in like Kevin MD and different sources about things that are not really urological, but it's about life and humanity and ego and hierarchy and compassion and things that should be sort of obvious in medicine, but sometimes get a little bit lost in the shuffle of being prescribers and technical technicians in surgery. And even though we started going into medicine for that, we sort of lose it sometimes. And I think it's so important that it's about people. Like if it's not about people, then we just be robots. So, a robot could probably, do it and give you the pill and you come back, but it's about humanity. It's about the person in front of you. It's about having that connection, really being present for the person in front of you, who's not just a symptom or a surgery to be done. It's actually a person, and what is going on in their life, whether their husband just died or they just had surgery on their toe, really affects what's going to happen of how I take care of you. And I know some people feel uncomfortable kind of diving into that, but it's so important because
I think patients sometimes want to know, they want their doctors to probably know a little bit more, because in incorporating some of these, like I've had patients in the ER who are coming in and coming in for symptoms, like saying it's like, wow, well, and then you find out that medically you've checked everything out and it's fine, and then you just hear this one statement, oh, my loved one just died 2 weeks ago in the same hospital. And that changes the whole parameter, right? So it's knowing a little bit more, incorporating it really does help with the art of medicine, not just the science of it.
But the key you said was like listening, right? So if you're not present, you're just gonna skip right through it because you're just not present, right? You're just like bah, 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 which is difficult. You have all the stuff you have to type, you have like 300 patients, you're running behind, you're stressed, you're burned out. So you have all the other stuff too, and then you have to be present, right? Which is, it's a little bit of an impossible task, right? Like, okay, we gotta know all the science, we gotta know all the knowledge, we gotta know what to do, and also do all the notes in time and run in time, and but then you gotta be present, right? But if you can be present, I think it's so powerful because patients give you the whole story if you listen. They tell you exactly what's wrong with them. They tell you what is bothering them, not what bothers you as a doctor, but like what is bothering them.
Absolutely. That's what we were taught, right? 80% of the diagnosis is in the history.
Yeah, just like listen to the people, what they're telling you, because they're coming with a problem. So if we're present, if we listen, if we have compassion, if we have humanity, and we can sort of put ourselves in the shoes, well, like, yeah, my patient is homeless. It's going to be a little hard to manage that catheter, right? Like, so it's not going to be so easy. So yes, I can tell you to put it in, but really, how are we going to do this? So I need to understand that. I need to be aware of that. I need to work with you and find the best alternative solution, but that maybe it's not in the box, maybe it's not in my manual, but we got to work with you because I want the best for you, right? So we got to just know that. And I got to know that, like, your husband just died, and then how that's affecting, and because you're so stressed from that, that stress leads to like overactive bladder, because your mind is connected to your body organs, which is connected to your bladder. So if your mind is in a stressful, reactive mindset because you're dealing with grief that you haven't resolved or anxiety, it affects your bladder. So I can fix your overactive bladder all day, every day. I can give you medications, I can do, but if we don't fix your mind as the cause of it, and we just treat it with a symptom, it's not actually going to be that effective, right? It really isn't. And I see that all day with pelvic pain, testicle pain, you know, all these other symptoms, bladder pain. It all comes from, you know, getting worse by the mind, not caused by it all, but with the stress, the anxiety, which, you know, it's an understatement with COVID and everything.
I know.
But if we don't address that, and we don't understand how that's really important, you know, yeah, you're going to get a little better, but it's not going to get that much better because it's just a Band-Aid and we're not dealing with the cause. So it's so important. Yeah,
absolutely. So, you know, when we even think about this, as we're gonna like, you know, and there are two aspects to what we just mentioned. We have the aspect from us as doctors and, you know, our fulfillment of helping our patients and trying to do what's right with the time constraint, but also trying to use some of the compassion and some of the technique that we've learned in school, which a great part of it is listening in addition. And then also what we mentioned from the patient's perspective, not being afraid to ask, you know, not being afraid to ask why, so that you can take those medications with confidence, or you can say, well, it's not really bothering me and I will, you know, choose to not take the medicine at this time. All of this helps to have great doctor-patient relationship, which is what every doctor wants. And also, I'm pretty sure what every patient wants, feeling confident in their doctor, feeling comfortable in it. Yes, my doctor is the best because they helped me with this. And, you know, I'm feeling so much better. As a matter of fact, if you're having anything, go to my doctor because they are doing so, you know, they're such miracle workers. So with all of this, you know, we've covered so much in such a short period of time. And, you know, Dr. Londoño, you are a gem. I'm pretty sure that anyone who's in the LA region, if you are having any urological issues, just look her up. Look her up, Dr. Londoño. Let's give her a round of applause for all that she... Woo! Yes, you are a gem indeed. And I'm pretty sure we probably will be reaching out for you later on to get some more gems and info. Can you let us know where can they find you if anyone would love to connect with you, especially if there's a student out there who is listening and they're like, I would love to be a urologist, but I don't know any female urologists.
Yeah, of course. Yeah. You know, absolutely. Like, you know, I am active on Twitter, and my Twitter handle is just my name, Diana Londoño, Londono. M as in Mary, D as in dog, MD. That's Twitter. So you can, you know, message me that way. On LinkedIn, if you're on LinkedIn, I'm also very active. Or you just Google Diana Londoño, MD. That's my website. You can go there, learn more about, you know, me, what I do, what I write about, and just contact me that way. I'd be happy to definitely connect. And yeah, I mean, if you're thinking about urology, we were talking about it, you know, before the interview, it's really a great specialty that people gotta just really know is a little secret, because it is, you know, you treat men and women or men only if you want, or women only if you want. You can choose, or you can do a mix. You can start out with a huge, heavy surgical practice and do big surgeries, like take out the kidneys, or take out the bladder, take out the prostates, or like reconstruct, or you can do more plastics, or you can do kids. There's such a range of stuff you can do. And then as you get maybe older, you want to do more just clinic, you can do just clinic. And there's so many procedures in the office you can do which are fun. Like you don't have to be in surgery all day. You could do outpatient surgeries and have a full practice doing outpatient surgeries where they don't stay in the hospital for 5 days. And, you know, you can have a great quality of life. You could just do procedures in the office, which are fun and, you know, very helpful for patients. You can do Botox for the blood. I mean, there's so much fun stuff you can do. And you have patients long-term if that's something you like. If you don't, or you just want to take out their appendix and move on, well, that's not probably for you. But, you know, have patients that I used to practice in Miami. They follow me to LA and they come for the checkups, you know, in LA. And it's like long-term relationships. And then I see their wife, and then I see their, like, you know, sister, and I see the men and the woman in the same families. I have some patients, I see like 4 people in the family, you know. So that's just really fun. Again, if you want to prescribe stuff, you can. If you want to do more surgery, you can. I mean, there's such a range, and it's like happy urology. Like the cancers that we deal with have sort of like the highest survival rates. A lot of stuff is preventable. And it's like happy, like if you can't pee and I put a Foley and then like you can pee, you're like, yay, like they love you.
Absolutely. I've seen that.
Yeah, you're like, call the urologist, and you're like, boop, and like it's like, you know, it's just a fun feeling to help people like that. And also to help your colleagues, like when the ER doctors freaking tried and they're heroic, and you're like, yeah, that was a hard one, you know, and it's a hard one for me too, but we got it because I practice in so many different ways. So when you can help a colleague who has tried, and obviously like they know their stuff, but like we know our stuff. So it's just collaborative. It's fun. It's like happy. You know, if you have a little sense of humor, it's probably helpful because we can't be that serious all day, you know, dealing with stuff that is, you know,
most of us have a sense of humor.
Yeah, so we kind of have to like, so if that's kind of your personality, you'll kind of gravitate towards it. But don't let the fact there's not a lot of women now be a deterrent factor. Like absolutely most of my cheerleaders have been men, you know, so like the men are amazing. They're great colleagues. So that's not a deterrent. If you're a minority, who cares if it's 0.5% or if your Black is 0.6%? Like, there's so much room for improvement. That's the good news. So don't let it be like, oh God, don't be like, this is awesome. We're going to make this so much better, and you're unique. So use that as something to be proud of, and not something that's going to defeat you. So absolutely, like, reach out, you know, if you want to talk about urology, what is it, how long, what happens, like super fun.
Wonderful, wonderful. Thank you so much, Dr. Londono. You are a gem. Oh my gosh.
So much for the invitation. I really have appreciated talking to you, and you know, you're a professional at this, so you're amazing too.
No, this was wonderful, wonderful. So everyone, you can find this great interview on our podcast, our Your Caring Doc podcast, Docs Who Cares. And it also will be available on our YouTube channel and on our website. That's our Your Caring Docs website, which will be up soon. We're revamping it. It's www.urcaringdocs. This great and wonderful interview is also going to be available on our YouTube, and you'll be able to find it on our different social media handles, such as our LinkedIn, our Instagram, our Twitter, and also our Ticking and our Talking. You can find it anywhere. So thank you so much, Dr. Londoño. We are going to say bye-bye.
Bye. Bye-bye.
Take care. Bye-bye.